Like professional setup, man.
That's right. Okay. Ready to dig in?
Yeah, dude.
All right. Welcome to the Sultans of Spine Podcast. I'm your host, Jamil Pendleton, and I am so excited to introduce our guest. Before I do, the Sultans of Spine is basically meant to just have a little bit of under the hood in terms of the spine and robotics industry, which is one of the fastest growing spaces in med tech. And what better way to learn about the industry than from one of the surgeons who's pioneering these new technologies in his practice today. So Dr. Rajpal, without further ado, if you could introduce yourself to our audience.
Well, great. Thank you, first of all, for inviting me today, Jay. I'd like to think that you invited me simply because we're both equally bald.
That's right.
But perhaps that's not what it is. So I've known Jay for a long time here, and I'm a neurosurgeon. My name is Sharad Rajpal. I'm a private practice neurosurgeon over in Boulder, Colorado. I've been in private practice since 2010. I did a neurosurgery residency at the University of Wisconsin in Madison, where I trained and grew up in the Midwest. So I'm a Midwestern guy and a Badger at heart. And then I did a one-year fellowship, combined orthopedics and neurosurgery with Dr. Ed Benzel and his group over at Cleveland Clinic for 1 year. After that, I came over to Boulder, Colorado, and performed, now in private practice. So awesome. That's where we are today.
So it's fascinating for me. I've been a guest on a couple of podcasts, and now I'm starting my own. And it's fascinating to me because one of the things that I think was interesting for me to just vocalize my path of how I got to this point. And so that's kind of what I'd like to start with. Like, what was it that made you want to become a physician, a neurosurgeon? Like, kind of, what was that path? And, kind of, did you always know, or just? Yeah,
that's actually great. So, I'm actually Indian by birth, and generally our destiny is written when we're born. Either going to be a doctor, an engineer. So that's kind of how it began. But right. In all reality, I was actually, when I was growing up, we used to go back to visit my grandfather back in India. So every 3 years growing up, we'd go back to visit my father's father. Right. And he was a very small community general practitioner. And it was fascinating to me to be able to play in his clinic. So I would spend the days with him all summer. We would sit at a table. He would see patients all day long. I would get to help him. I would just grab the bandages, grab the syringes, just things like that. He was sort of his assistant for a long time. And what I really saw in him was his dedication. The guy was so dedicated to his patients. And so, we would spend 2 or 3 months in India, my whole summer with him, watching that, come back to the States. So just growing up, I really watched this gentleman. He became really, in my opinion, he was somebody I really looked up to. Right. So really wanted to be a physician from that standpoint. So that is where the influence came in to become a doctor. And in fact, my aunt was a doctor as well. So the interesting thing is he's actually a general practitioner, very well respected in his house, but he never turned anybody away. Right. I was following that pathway. And then I always tell people you can either go the path of medicine or the path of surgery. That's your sort of two generalizations. And I have a type A personality, just like you are. I like to be in control. Yeah. And what
I'm laughing because of just the setup of this room. We're trying to figure it out, like where to sit. This is normally done in separate quarters, but we're here together in Miami. So why not? Anyway.
Yeah, no, I'm glad we were able to do this together. So, the thing is, as a type A personality in general, what I learned doing through my rotations in medical school, which I got into, I realized that in medicine itself, so just people that are your general practitioner, your primary care doctor, right. A lot of people would keep coming back through the door, they get the diabetes and the high blood pressure and things like that. And, come back for a check, and then they may or may not have done anything differently. So it's just kind of it's a lot of social. Sure. Some people don't want to take control of their healthcare, those kinds of things. And it was frustrating to me to watch that process because I felt like there was a lot of desire to help people. Right. And unfortunately, a lot of people, and that's a terrible generalization, but a lot of people don't want to take care of themselves.
It's reality.
It's reality. So I did a surgery rotation in college, and I realized, surgery is instant gratification generally. That's right. You go in there, and if it's a tumor, you take it out or whatever it is.
Whatever it is.
And I'm in control.
Yeah.
So if we go to the OR and I take something out, it's done, usually one and done if that's possible.
Sure.
You fix the problem and you move on. So I tell people, it's a terrible generalization. There's thinkers and there's doers.
Yeah.
And the medicine doctors, as smart as they are, there's a lot of thinking going on there.
Oh yeah.
From a surgery standpoint, it's a doer. You fix it and move on. That's sort of my sort of initial pathway.
That's fascinating.
Yeah.
And thanks for sharing that, because I think that like, whether you're watching this and you're a surgeon, hopefully you are, we would love to have surgeons watch this. Or if you're someone that's selling on to surgeons or trying to get into this industry, for me, it's always been very important to understand like what makes people tick, why you do what you do, as it relates to your practice, as it relates to how you take care of your patients, how you structure your day, so that we can ultimately provide the most value that's on point with where you'd like to receive that, would call it solution, right?
Yeah, you're right. I've heard you talk about that before as well. Knowing your audience. That's what you're talking about.
Absolutely, knowing your audience. And where do you see kind of, I mean, if we could talk a little bit about healthcare today, or this maybe spine surgery today, just where do you see it today? What are you excited about tomorrow? Just kind of your overall thoughts on the industry.
I mean, I think coming into, we're actually currently at a course, called Future Spines Leaders. And really, I think, I've been coming to this course ever since I was a resident fellow that was going to be coming out as well. So I saw that, and it's kind of interesting to be reflecting back now and being sort of on the other side of the podium now, teaching these people that are coming out. And I think that, healthcare in general, it's always changing, but really for spine, we're at an amazing time, I think, in spine. It's really exciting to be into it. I mean, neurosurgery in general is the youngest surgical field, as you know, right? It's only about 120 years old compared to most surgical specialties. So first of all, we don't understand much about the brain, if you look at it that way. So we have so much to learn and so much to do. If you look at spine technology, we are really, I think, at this, I call it the inflection point, where we're really starting to become like other surgical specialties, right?
Sure.
In regards to technology, like we have technologies that we have in the OR currently, but now the new integration of so many things like robotics, and we talk about all these things, AR, VR starting to be integrated, AI. So use all these terminologies, but these are all the things, right? I mean, you got the Mako for orthopedics, which has been around for a while. Got the Da Vinci robot for general surgeons, urologists, gynaes, all those kinds of people. We finally now have robotics that have really sort of started entering the OR. So we're at this really infancy of technology, which is just so fascinating, because think of the things that we can do so much better than what we've been doing for, decades.
For me, when you hear robotics, I mean, you get that kind of like Terminator 2, like they're going to take over, but it's really it's a robotic assist initially in the OR. And we'll park that for a second, because I do want to talk about your workflow relative to robotics. But I think for me, what I've learned talking to surgeons like yourself, seeing it from an industry standpoint, it's really the preoperative plan that, at least now, is such a game changer. And what I mean by that, for those people that don't truly understand what this gentleman does and people like him, every patient has different anatomy, and every patient has a certain what's called pathology. So like why their leg or arm hurts, right?
Yeah.
And you have to just, based on your skills, based on what you know on in your hands what works. You have to come up with a unique plan for every single patient, and it's always changing. So preoperative planning, like where does that fit into that? Like your algorithm, your kind of
and it's interesting. One of great mentors, you always say at the beginning of your training, you learn how to operate. So that's what we spend all our days doing, is just learning how to do it technically. And as you get older in life, you learn when not to operate.
Great.
Okay.
Yes.
Because it's really sort of it's the decision-making before you get to the OR that's really critical. Not everybody with back pain needs a spinal surgery. And so that's sort of one important thing. So that's what we have to develop, right? First of all, is learning who's an appropriate candidate for a surgical procedure. That's your preoperative evaluation. Once you sort of catch that patient, say, okay, you're a good candidate for us to intervene from a surgical procedure. What I think we can do now, you're asking me about the future and the technologies and the AI and the data collection, things like that. We have surgical techniques that we do, but even as we've discussed and you've heard lots of times, even amongst multiple surgeons in one patient, we always say you have 5 opinions from 5 surgeons, you'll get 10 opinions.
Absolutely,
right?
yeah.
So even one surgical procedure, one pathology or problem for a patient could have multiple solutions.
Sure.
But what we don't do well, I don't think today, is we do a lot of things really well, but what we could do better is trying to figure out if you sort of take the patient as almost like an onion and you peel apart, because there's there's psychological,
absolutely,
the biology of the individual. So the pathology, the problem that why they're in your office, a lot of those factors actually play into it as well, as we know. You know, is it a workman's comp patient or is it not? So what's the extrinsic motivation for somebody to show up in your office?
That's amazing.
But those are all part of the game.
Absolutely.
Right. That's what you're saying is you have to learn when not to operate. When somebody has secondary sort of gains here, they're not going to get better with what you do.
That's right.
So that's a sort of a long way to get to the point of we can really do a better job here of saying now we collect all this data on people. So, you know, Jay, this age, this height, this BMI, this socioeconomic, he shows up in your office with this problem. And you take the data set of all these thousands of people that have treated it and say, okay, you know, if I'm the surgeon, I say, Jay, you need a cervical fusion.
Right. And
then we plug it into the database and it says, actually, he doesn't need a cervical fusion. He needs an artificial disc or needs something called a foraminotomy where we come in through the back. That would be the better surgical solution. So we should hopefully be able to navigate with the technologies we're talking about. Maybe it could be the guardrails for where we are and do things better. And I think that's where the excitement comes as maybe we can become more homogeneous with our treatment, not because people are homogeneous.
Correct.
But then we have a better understanding with how we can treat them.
It's absolutely, because you're able to, in that scenario, which you just described, which is brilliant, is taking the training. Like nothing's going to replace you seeing a patient, right? And all those onion layers that you talked about, you're now adding the power of data in AI and just mining that and categorizing that into like a better potential option, or maybe just whittle down all those potential avenues.
Yeah. I mean, I think I talked about homogeneous, but really what the answer is, it's actually customized. Let's put it that way.
Yes.
It's customized care. So you and me are not the same person, you know, even though we look very similar, we're not the same person.
That's right.
And I do have the bow tie.
I do not. Sorry. Yeah, it just outdid me. I mean,
but you know, even though we're very similar people in terms of age, size, all these things, you and I literally could have a very different pathway for a similar problem that may come up. So it's customized but homogeneous. Does that make sense? So it's kind of counterintuitive, but I think that's where we would win.
Yeah.
You and I might have different outcomes with the same surgery and should have done something differently. That's
brilliant.
That's the way I think that's where that's going to go with. Yeah. Right. That's where all this stuff, genomics, right? The robots, the AI, all these kinds of things. So that's not even in surgery yet, right? We haven't talked about it in surgery, but that's the pre-eval.
That's right.
Right. And to improve your outcomes.
And that's exciting too, because as he said, like we're at such an inflection point of this industry. It's growing fast. There's a lot of competition, but like really when you look at it, the sky's the limit in terms of where we can go. And it's exciting because when I started in this industry in 2008, it still felt like there was a lot of, and there has been quite a bit of advancements since that time. Yeah. And we're going to say the same thing in 5 years from now. I mean, in the last year or two alone, we've had this explosion in technology, right? Yes. I mean, there's been an explosion in just the last couple of years. And there was an interesting statement when I did my plastic surgery residency, a surgeon told me once, and I never believed him. He said, 80% of what you're going to do in your career, you'll never have done in your training, if you think about that. And I was like, whatever, nothing's going to change. We do front, back, cervical surgery. We do thoracic. So we trained in everything. I was like, I'm going to do all this stuff. Right. What could possibly come out and be different, right? Yeah. But literally, every spinal fusion I do now or surgical procedure includes navigation intraoperatively or a robot/cobot, whatever you want to call it. So even the fact that I use a navigation system, even if it's the same procedure I've been doing, I never did before. That's true. Right? Or you talk about the lateral approaches, things like that. So he was right. He was. And we're probably thinking the same thing for the next generation. Who knows? Maybe it's just stem cell injections. Patients don't ever need spinal surgery. Yeah. So, sky's the limit, like you said. I mean, where can we go? So where can we go is right. And as it relates to this conversation, I know we have a short period of time. There's so much that I'm fascinated in kind of like to a couple different ways that we could talk about. The one is kind of like your routine. Like I'm big into that. What's your surgery day, clinic day routine? Yeah. It's just potential question. And then, the other one is kind of like your brand, like as a surgeon, as a neurosurgeon in Boulder, as a very good practice and one that's, you're intentional about everything that you do. Yeah. I think that we're a lot alike in that regard as well. So those are a couple of areas I'd like to talk about as well. Just kind of your pick.
I mean, I think that probably you and I are very, from a routine standpoint, we're very much routine based. We don't deviate a lot from where we are. It goes back to that type A personality, being in control. I don't get up at 5 o'clock in the morning and work out like my man Jay here does. He's definitely got me beat in that arena. But I try to do my work and try to spend time with my family. Like that's really my avenue here. So, work is primarily targeting patient care. That's what I want ultimately. Good patient care. I live in a community. If I see them at the grocery store or the post office or, the waiter or waitress or somebody else to take care of my kids, I want to have a good reputation for myself because I want patients to do well. I mean, ultimately, that's why we're here. It's not for me, it's for them.
100%.
But then we have sort of the other competing factors, as you do too. You have families at home, kids and a wife and things like that. So, the routine is work, and then home is home. So we try to separate the two as much as possible. It's a challenge to do because we're always on the clock. People sort of always phone call you, things like that. So, from a routine standpoint, I don't really have a routine. The key is really to get the work done, focus on the work, get home, spend time with the family. That's sort of my routine.
Well, in terms of let's just one step further into the OR routine. Yeah. Do you like to do your tough cases first? Do you like to get a couple like decompressions or maybe a smaller surgery out of the way? What's that look like?
Sure. So, generally I'll do 2 days of clinic and then generally 2 or 3 days of OR. So I have a flex day on Fridays, but generally because I'm so busy, we'll add a Friday surgery day. Right. In terms of surgical procedures, we generally try to do the smaller cases in the morning because those patients in general will go home. Right. So if it's a small surgery, they can go home. So rather than keeping somebody without food, so NPO, for 7 or 8 hours to the end of the day when you finish the long day, that poor patient has been sitting there hungry all day long. So we can get them sort of fed after surgery, get them home. Nice. Ultimately. Then the long cases then sort of come in. And usually after you've done a long case, you're exhausted. You don't want to do a long case and then being like, okay, I got one more small case to do on there. There is a mental fatigue in addition to physical fatigue. We're standing there and it's just by the end of the day, you're a wreck because, it's an intense thing to be there. And I was having a conversation with somebody yesterday, there's very few jobs out there where you have somebody's life in your hands. And that's not to be dramatic,
but that's real.
When that patient wakes up, they have to be perfect. And if they're not perfect, the complication lies generally in your hands, whether it was directly or indirectly a result of what you did. So, that's a tough thing to swallow every single time. So just the stress level of that, which is why I think there's a lot of burnout is the intensity of what we do.
And I think that's something that we as an industry need to be cognizant of. And I've said this before, and I'll say it again, just realizing that how much you guys have at stake and how much at the risk and all of that is literally in your hands. And if something doesn't go right, there's a certain separation of, you may become really good friends with your intraoperative sales consultants, right? I have great relationships with surgeons that I work with. But there's a level of like, you walk to see that patient and we don't have any, like, that's just that separation. I don't know if I'm making sense, but
No, it's true. But I think that the reason why I have people like you and the company you work for, I tell my guys or girls that work with me, I'm 110% there, 110%. It's not a show up to work with 80%. Right. You can't show up with mental fog and fatigue or not be into it. Like you can't turn it off when you're in the OR. You are there and committed. So
very true. Guys
like you, the reason I like you, the reason we're friends, the reason we're in the same industry is because you're going to show up and you're going to give me 110%. So
every day,
but I expect that out of you. Just like you would expect that out of your doctor. So when we're in the OR, we're actually a team. It's not me alone because the success of the surgery is mine plus yours. That's so awesome. If you show up and you're 50%, get out of my room.
Yeah.
It's not fair.
No.
But that's why you are successful from what you do. And people in industry need to understand that.
That's so great you said that.
Yeah.
There's a reason. It is a privilege to stand in the ORs. It is a privilege to be a spoke on the wheel and to be part of their team. And it's competitive for a reason, because I think that, look, there's a many different ways that industry can approach this. But if you learn nothing else, if you're in sales, or if you're trying to get into medical sales or whatever, if you learn nothing else from this little talk, that's it. You need to show up every single day, prepared, ready for a long day. And because that's basically just gets you in the door, is being prepared and being ready and being physically and mentally there. And I mean, to your point, working out in the mornings, that helps me get ready for my job. Yeah. And I think it's just like, everyone has their own routines, but I'm glad you said that.
Yeah.
Because that's really, profound.
Well, it's somebody's family member on the table. Imagine if it was your mother and you heard that A, the surgeon was tired, or B, the rep didn't have the right equipment. So if we're going to do a surgery on your neck,
right?
And I'm in the middle of a case, and I'm like, okay, Jay, I need the cervical plate or the interbody cage. And well, I didn't bring the right sizes for you, doc. I'm like, so you want me to do a subpar surgery on this individual because you were not prepared,
right?
And of course, we would have had this conversation before, so we don't encounter this. And generally, this doesn't happen in my OR because we're having this conversation beforehand to ensure that this doesn't happen. But you have just screwed the patient on the table.
That's right.
And so I have to live with that because that's my patient. But if that happens, I will definitely have a conversation with you on the side to let you know what your decision to do or not do that day and your failure to show up has affected somebody's life.
In patient-centric is when I figured that out, it wasn't difficult, but it was early when I figured out, okay, nothing else really matters. This is someone, and I remember vividly, there was a surgeon we were working with, and everybody was just not really bringing their 110%. Stuff wasn't in the room that's normally in the room, basic stuff, and just things weren't really meshing. It just so happens that the surgeon was operating on like a family friend, right? And he he basically said, time out. Like, this is not how this is going to go. Everyone needs to up their game. And he used different language, but in a very direct way, like, this stops now. And from that point forward, it was just the necessary and so I wasn't planning on asking you this.
Yeah.
How do you handle intraoperatively when you need to course correct that team? Because you're the captain.
Yeah, I mean, again, we talk about being calm. That's a really important feature. So, you have to be, you are the leader of the ship, right? So most important in my room, always, my rule is anybody can speak up. We don't run an OR where I am definitely in charge, but I am not one of these people that will punish. I actually appreciate if somebody says, hey, you forgot to do something right there. I'm like, thank you very much for speaking up. So in our room, actually, it's a level playing field, and everybody knows that. So first of all, that's been shown scientifically and proven in so many ways to prevent complications and problems for patients. So everybody has the ability to speak up. So even if my rep says, hey, doc, I got a problem over here. Okay, I'm not going to yell at you.
Right.
Let's figure out the solution. What happened? Perhaps something to get sterilized. Okay, how long do we need till that kit comes out? 30 minutes? Okay, it's fine. Go ahead and work on that. I'm going to continue to work, or I'm going to deviate my plan. So I'm going to buy you 30 minutes. Not going to change what we're going to do for patient outcome, but we're going to change the game here so that we can, okay, I'm going to do maybe my decompression before I do my hardware. So we will continue that pathway. So I haven't really encountered a space where we've not been able to perform a surgery because of that inability, but that's again where the relationship comes.
Absolutely.
So my reps are almost like my friends. We treat each other as like equal.
Absolutely.
I want you to speak up for me. So course correcting is also part of it. And that's what we talk about as well. Being a good surgeon means that you can sort of, the day should be linear, A to B, but we all know it's not like that. So the deviations, it's okay if we ultimately are able to do what we need to for the patient. And I think probably 99.9% of the time we are planning for anything that's going to deviate, and we're ready for it as a team. You and I have chatted about, okay, what if we can't do this? Okay, do you have a backup set? Yes, I got a backup
Yes, I do.
set. Or I don't. I'm going to go get that ready.
Mhm.
So that's, I think, what helps to improve our patient outcomes
Absolutely.
because we're ready, right?
You're ready. You've got the backup plan dialed. That's sounds like a great OR environment. I mean, honestly.
Try.
Yeah.
Yeah, it's important. Again, it's patient centric. That's why we're there.
That's right.
We want to be running all cylinders.
Let's take I sent you a couple of these questions beforehand, but what do you think is a myth, a common myth about minimally invasive surgery, MIS? Because that's part of your practice, or a big part of it, right? So
I actually was going to just broaden that question.
Yeah, dude,
take it. Not even just MIS surgery; it's just spine surgery.
Spine surgery, yeah.
It's funny because I was going through your questions and I was like, MIS surgery. I'm like, we have a broader problem here.
Yeah,
Let's do spine.
Surgery. Let's do spine.
Yeah, it's spine surgery. So,
what's
in general, spine surgery is a bad rap. Nobody wants spine surgery. So
correct.
The problem is we actually have great outcomes, and what people don't do is they don't accept the fact that we have great outcomes. So there's definitely bad surgeries out there, bad surgeons, and not everybody does great. But the bottom line is, spine surgery's got a bad rap. Period. Not just MIS or not.
Well,
so,
Dr. Google, right? It's there's so much. People are going to find information.
Yeah, and I would say the loudest patient who's not doing well is the one who's going to be speaking out. So like if you're at a neighborhood picnic, the guy who had surgery is going to be like, I did terribly, yada, 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 but you're not going to hear from the 5 patients that are doing great, right? People that have a great, go to the internet and complain. People that are doing great, don't say anything.
That's a good point.
So
for anything.
But especially that's reality. Yeah.
That's interesting.
So, so I think spine surgery in general has got a bad rap, not just MIS.
No, it's well, and hopefully these types of discussions and conversations that we have, the industry, if there's people out there sharpening their saw, listening to what Dr. Rajpal is saying, maybe listen to some of the things that I've learned over my career. I'm not as credible of a source, but having lived this world for a lot of my professional life, like it's an honor and a privilege to work with surgeons like you, and thank you for sharing a little bit of your world, of your vision, and of just kind of this unique little space that we get to work.
Well, I appreciate being on here, man. I appreciate all that you do. Thank you so much.
Thank you. Thanks for joining. Appreciate you guys tuning in, Sultans of Spine, and come back next week.
Thank you.
Thanks.